Hi everyone, my name is Misha O'Donnell, and this presentation will be helpful if you've had a family member or friend who recently experienced right hemisphere damage. This can provide you with some basic information about the damage and the resulting right hemisphere syndrome, as well as provide some tips on how to communicate with the person. So, what is right hemisphere damage? It's damage to the right side of the brain, and most people know that the left hemisphere is responsible for language in most people, but the right side also has many important functions for communication. The right side of the brain is responsible for understanding emotion, facial expression, and body language. Without these areas, it can be very hard to understand language and communication. The right hemisphere is also responsible for math and perceiving distance, perception of shapes, and it also plays a role in understanding music. So, some causes of right hemisphere syndrome. The first one and the most common is a stroke, which occurs when there is an interruption in blood flow to or within the brain that destroys brain tissue. A brain tumor, which is an abnormal growth of cells in the brain. Trauma or traumatic brain injuries, when serious or life-threatening damage to the brain occurs as a result of an external forceful event to the head. An example is a car accident. And lastly, another cause is degenerative disorders. These are disorders that result from a systematic breakdown or destruction of structures within the brain. These disorders can cause damage in both the left and right hemisphere of the brain. The patient's doctor may conduct the correct procedures to determine what caused the right hemisphere damage. So, if you suspect someone you may know may have brain damage, some of the cognitive deficits they may have are difficulty holding words in their mind, so they can't remember certain words or what they want to say. They might have difficulty with time. For example, they might not have any sense of what day it is, what time it is, or even when their birthday is. They may be unable to feel the left side of the body, may also not be able to respond to things on that same side. For example, they may only read on one side of the pages in a book. They may have difficulty programming speech, which can lead to frustrations as they know what they want to say, but they're unable to say it. And they may use irrelevant language, so they may fabricate experiences to fill gaps in their memory. And they also can have difficulty recognizing faces. Unfortunately, this does include family members, which can be really hard for both parties involved. And oftentimes, they do not even know they have a problem. They may try and blame their friends, their family, or even their doctor. So it's important to let them know that you understand that they're frustrated. So, some communication difficulties they may have is difficulty telling and understanding stories. This is such a big part of communication and conversations. They can also have difficulty understanding words with multiple meanings. And they also can have problems with the social use of language and difficulties understanding emotions and also expressing their own emotions. So these can all contribute to difficulties and frustrations with their everyday communications and interactions with other people. Social interactions suffer when you cannot correctly understand other people's emotions and you can't express their own. As you can imagine, it can lead to a lot of frustration. And they also can have problems with jokes and figurative language, which is very common in everyday communication. It may be hard for them to stay on topic and take conversational turns as well. So, what does this all mean? Remember, there's different severity levels of right hemisphere syndrome. Not all of these symptoms will be present. There may be only one or two present, or all of them could be there. It just depends on the severity. So, if you suspect a family member or friend may have right hemisphere brain damage, you want to take them to the doctor. From there, the doctor can refer them to any specialist that may assist in their diagnosis and treatment plan. The speech-language pathologist will work on speech and communication, and they may also need an occupational therapist and a physiotherapist. Excuse me. So, what can you do to help? There are definitely a lot of strategies that may be useful. You can make sure that you talk slowly when you're talking with them. You want to use short, concise sentences so they can understand your speech and have time to process it, and they also need more time to respond. You want to make sure that the context or what you're talking about is known and it's easy to infer. If you randomly start talking about something out of nowhere, the individual may not be able to know where that came from or where you got that idea, which can make things difficult. You want to make sure that you're really empathetic in understanding their frustrations. Do not talk down on them, but say that you understand that they're frustrated and that they can take their time and stay calm and just try their best. You want to foster success. If they communicate well or have a good day, give them praise and reinforcement. And overall, you want to make sure you accompany them to their appointments, as they may have difficulty understanding what they're supposed to do or work on. And you just want to make sure that you're always there for them and let them know that they can come to you with any questions or concerns. So that concludes my presentation. Here are my references, and thank you very much for listening.